Hi everyone! Informed consent is a medical legal requirement or procedure to ensure that a patient knows of the risks and costs involved in the treatment. According to Malaysia Dental Council Code of Professional Conduct 2008, dental practitioners shall obtain valid consent prior to carrying out treatment. The practitioner should explain to the patient the treatment proposed, the risks involved, advantages and limitations, alternative treatments, and cost. Today, I would like to show you on taking consent from a patient coming for surgical removal of third molar. We focus on the complication of the procedure. Come in. Hi Miss Chun, good morning.
Good morning.
I'm Dr. Pao. So today I'll be performing the extraction of the wisdom tooth for you. So this is the consent form. So by looking into your case, as you can see in this radiograph, so this is your lower right wisdom tooth growing in the wrong direction, which we call it impacted. So it is prevent from growing fully into the mouth by the tooth sitting next to it. Okay, and you also complain that you got recurrent inflammation of the soft tissue covering your wisdom tooth, right? So to solve your problem, there is 3 ways. Okay, the first one, we will help you to rinse that area and then help you do scaling to flush out the debris and everything. And then at home, you need to use mouth rinse. Okay, but this can just temporarily solve your problem and the problem can come back again. The second one is we can help you to cut the soft tissue covering your tooth so that you can brush that area more better. But then the soft tissue can grow back and cause problem again. And the third one is to remove the tooth surgically. And we understand that you can choose not to extract the tooth, but leaving the tooth in place can have possible risks, can result in infection and inflammation such as swelling and pain. Sometimes pus can form and they can spread, can cause systemic disease. In rare case, can spread to the brain and cause brain infection. Others are like gum disease, biting problem, and then they can also create food trap, which in long term can cause decay to the wisdom tooth and also the tooth sitting next to it. So all surgery comes with risk and unwanted complications. So I would like to explain to you the possible complication particularly related to the surgical removal of the wisdom tooth during and after the procedure. So during the procedure, as you can see here, first one, injury to the nerve supplying the jaw, the tooth, the tongue, or the lip may occur, which is 1 to 5% of the case. Pressure acting on the nerve during extraction may result in numbness, tingling, burning, or loss of the taste. And the nerve injury can last from few days to few months or could possibly be permanent, which is less than 1% of the case. Fracture of the jaw, root, bone fragments is possible even though we carry out the procedure carefully. The jaw fracture may also involve nerve injury, and this requires referral to specialists for further management. Treatment of the jaw fracture may involve surgery to fix and stabilize the jaw. The fracture root may also displace into the tissue space, which again require referral to the specialist for surgical removal. Damage to the adjacent tooth may occur, which include tooth luxation, that is some degree of tooth mobility, and chipping or fracture of the natural tooth, the fillings or porcelain crown. And this will be managed by polishing, repair or replace a whole new restoration. There is also complication after the surgery. Pain and swelling is anticipated after the surgery, which will last for 2 to 3 days and should improve afterwards. In wisdom tooth extraction, there is also increased risk of dry socket, which is a very painful condition. This is because the blood clot is not formed properly in the extraction socket, exposing the underlying bone, and the pain usually develops 2 to 5 days after the surgery. About 3 to 4% of the case develop infection, even though we try hard to maintain the surgical sterility, because the oral environment is rich of bacteria. So after the surgery, infection may occur, and in worst case scenario, you might be needed to be hospitalized and treated with intravenous antibiotic. Muscle and jaw soreness as well as difficult in mouth opening may be noticed following the surgery. And if you got pre-existing jaw joint condition, this may be worsened following the surgery. So here are the listed possible risks and unwanted complications, but are not limited to what's stated here. So you can go through everything again, and then if you got anything you want to ask, just ask me, okay? For the procedure, I will first numb your lower right jaw and then cut through your gum and lift it up. Next, I will remove a little bit of the bone exposing the tooth, and then cut your tooth into few pieces and remove it from the socket. Lastly, I will clean the socket and stitch it back. The whole procedure will take about 30 minutes. If you agree to proceed with surgical extraction of the wisdom tooth, sign below. I hope everything is clear.
That's all from me. Goodbye.